Hi, good evening, everybody. We are doing a town hall this evening on Suicide Awareness Month and also how it intersects with Hispanic Heritage Month. And we're going to have a great discussion this evening. I'm really looking forward to this discussion. We have two great guests this evening here with us to discuss, mental health awareness and some resources that you may or may not know that we have. You can go to the next slide. Um, so I'm going to go ahead and jump into introducing our guest speakers. Oops, uh, there we go. All right, so introducing, first I want to introduce Dr. Marni Stahlman. Hi, Marni, we're so grateful that you're here this evening. Thank you so much for being with us.
My pleasure,
Um,
Rep. Thank you for inviting us into this important conversation.
Absolutely. Dr. Stahlman is a seasoned C suite executive and transformational leader with over 38 years of experience in healthcare, behavioral health, and nonprofit management. She currently serves as president and CEO of the Mental Health Association of Central Florida, and they have like a yearly fundraiser, and it's amazing. They have wonderful speakers. Henry Winkler was a speaker. Most recently, Ice T. I had to include that in there. I had to editorialize for a moment. Um, where over the past 5 years, she has significantly expanded access to healthcare for the uninsured, increased patient capacity, and driven revenue growth through strategic partnerships and advocacy. Dr. Stahlman's career includes leadership roles in behavioral health hospitals, educational institutions, and healthcare nonprofits, where she has overseen multi site operations, implemented deployment of electronic health records, and managed complex collaborations with hospital systems, government entities, and academic institutions. Her expertise spans stakeholder engagement, mental health system development, grant writing, and public policy. A dedicated advocate for equity in mental health, she serves on numerous advisory boards and commissions and has been recognized with multiple leadership awards for her impact in community health and behavioral wellness. A Central Florida native since 1975, Marni Stahlman was raised in Winter Park and is a graduate of Winter Park High School. She is a mother to her 17-year-old daughter, Lily Mae, and has been married to her husband, Paul, for 20 years. Congratulations. She holds a BS in psychology from the University of Tampa, a dual MS in counseling and psychology from Troy State, and a PhD ABD in clinical sexology from Maimonides University. I hope I did not.
Maimonides.
Maimonides. Okay. Oh my goodness. And so we are so happy to have her here. She is an incredible advocate. She is everywhere all at once. Our next guest is Daniel Vanegas. Daniel Vanegas is the Director of Advocacy and Public Policy at Heart of Florida United Way. In his role, he is responsible for shaping and directing their advocacy efforts and public policy engagement, particularly in the Central Florida region. He also participates in regional and cross-sector initiatives, including as a member of the Advocacy Advisory Council for the East Orange Chamber of Commerce. Say that 3 times. Representing Heart of Florida United Way in government relations discussions. In these spaces, Daniel helps connect the Central Florida community with various resources available to them, including community safety, public and mental health, and financial assistance. In his broader community work, Daniel is involved in the Homeownership Equity Initiative, promoting equitable housing and access. He is a strong force for advocacy, policy, and community systems work in Central Florida. Many people, a lot of people know you both, see you all over, and we are very grateful to have both of you here this evening for this discussion.
Thank you, Rep. And I may add, I am also Winter Park High grad, so we have two
Oh,
Wildcats in here.
Go
nice.
Cats. It's homecoming week, Daniel.
Perfect.
Winter Park repping tonight. I love it. I love it. All right, you can go on to the next slide, James. All right, so we're going to go into our discussion, and you can move. So I want to kind of frame this a little bit. What we're going to be discussing, the current state of mental health in Central Florida, local resources, community challenges, stigma reduction, and more specifically, we're going to start out talking with Dr. Stahlman. We're going to discuss what the association is doing to expand access and education. So, Dr. Stahlman, I wanted to start with you. I do have a few questions for you. Um, I wanted to start by asking, what exactly does the Mental Health Association of Central Florida, what exactly is their role?
Yeah, thank you so much, Rep. And so the Mental Health Association since 1946 has been the lead advocacy organization, not just here in Central Florida, but across the state of Florida, and helping to educate and advocate for individuals that are living with, managing, or encountering people with either severe mental illness or are occurring crises in mental health. And it's an important distinction as we talk about our mental health and well-being to understand that there are individuals that have chronic mental illnesses, and then there are people that have and encounter mental health crises that can be debilitating, but can also encourage and have remedies that don't have to be long lasting and impactful, that can in many ways be devastating along the same lines as a severe mental illness. Along those lines, for the last 80 years, as I've said, we've been the lead advocacy organization, spending quite a lot of time actually up in Tallahassee crafting
Hmm.
legislation and assisting individuals like yourself, key legislators in our communities, about how to advocate and create opportunities from a statute standpoint that can protect and provide for individuals that are grappling in their communities with mental health needs. We certainly have seen for many years here in the state of Florida that we have underprovided and underfunded agencies and organizations, much like the Mental Health Association and also our hospital partners, with providing for services. In fact, I just participated in a roundtable community event with Commissioner Kelly Semrod last week on the intersection of homelessness and mental health, and the concerns that we have about our housing crisis, the shortage of affordability of those housings, and as it pertains specifically to individuals who are grappling with mental health diagnoses. We see many, many times, unfortunately, that as these individuals age and become adults, we don't have inventory of housing for people with disabilities where they can be protected, cared for, and treated in a humane way that doesn't require institutionalizing. So that's a long way for me to go around to answering your question, what do we do? We have evolved at the Mental Health Association over time. And more recently, I would say within the last 15 years, we operate a free and charitable clinic. We're a member of the Florida Association of Free and Charitable Clinics. We're located in downtown Orlando on the corner of Westmoreland and Church in the heart of the Paramore community. And we provide mental health counseling for individuals as young as 6 years old that don't have health insurance and are at or below 300% of federal poverty guidelines. For an individual, that's about $46,000 annually. And for a family of four, that's about $95,000 annually. And when I say we provide for them, they're eligible to receive outpatient counseling, group therapy, and medication at no cost.
Oh, wow, that is incredible. You had mentioned the intersection of mental health and homelessness, and seeing that it is Hispanic Heritage Month, I was wanting to ask you about the intersection of mental health and marginalized communities like, the Hispanic community or the Black community or LGBTQI community. Do you see that there are certain obstacles there that are difficult to overcome, or are you seeing that you are finding ways to overcome those obstacles?
Yeah, so I would go as far to say that in many Hispanic cultures, health is seen as holistic. However, there is sometimes a tendency to prioritize their physical ailments, our physical states, over our emotional struggles, which can oftentimes lead to underreporting in the communities of the mental health needs. And so it's very important that we, not just within Hispanic cultures, but all communities, all cultures, really try to work on not separating our mental health and our well-being from the state of our physical health, as if one matters more than the other. Because the truth is, both are linked inseparably. Stress can affect sleep, our blood pressure, our immunity levels, while physical illnesses can impact our mood and our ability to focus. And by treating mental health as part of a whole person wellness approach, we really, really can make impact about reducing stigma and encouraging people to prioritize their well-being the same way that they would a general checkup or exercise or nutrition. In fact, the key here, I think, is that taking care of your mental health is not optional. It's foundational to living and working well.
Mm-hmm. No, it's absolutely true. What have you found? What are ways that schools and workplaces can help integrate, um, that sort of holistic view of mental health? What are some things that they can do to help that?
Yeah, and again, within the cultural lens, many Hispanic employees value close interpersonal connections and respect for authority. And at the same time, they may hesitate to speak up about boundaries or stress for fear of seeming ungrateful or disrespectful. The truth is, a lot of work has been done post-COVID about creating healthy workspaces where people feel safe to speak up, to set boundaries, and recharge without guilt. We're seeing today, statistically speaking, 90% of the time that people will call out sick, it's really due to mental health. But
Mm-hmm.
they're not feeling comfortable, they're not feeling safe about being able to report that they're struggling with anxiety or depression because the way the workplace may view that. And so culture is shaped not only by policy, but by our everyday behaviors. And we need leaders to model and to show that we can balance, that we can have coworkers respecting the time off that they need, that managers are interested in checking in with empathy, and that organizations value people as whole individuals, not just cogs. We need to invest in this. We need to invest in performance and in innovation and retention. And that mental health doesn't thrive in isolation. It thrives in supportive communities where everybody can play a role. And this means we need to encourage our employers to be proactive. We need to create opportunities within benefits programs where boundaries are established, but also invitations are extended for employees to access resources that they can then come back to depend on. One of the things that we see, and I know you have worked on this in the legislature during your tenure as well, is creating opportunities for what we call parity, where mental health and our regular physical health is recognized in our insurance benefit options equally. Can you imagine if a woman were to step forward having been diagnosed with breast cancer and being told at the time that they get their treatment protocols that while the doctor has prescribed a regimen that requires 10 chemotherapy appointments, the insurance company is only going to pay for 5? That's unheard of and would never happen. But it does happen with psychiatric and psychological diagnoses because we still don't have full parity here in the state of Florida, even though it is in statute.
Right. I wanted to turn the conversation over a little bit to Daniel. Daniel, I'm going to start out with the same question. More specifically, I don't want to. I want to ask more specifically, what is 988? How does it work, and what happens when you call?
Yeah, thank you, Reb, and thank you, Dr. Stahlman, for all that information. That's very important information to share. But 988 is the suicide hotline. So for most people that are not aware, the suicide hotline for many years functioned as a 10-digit number, excuse me. And then around 2020, 2022, my dates might be fuzzy, they transitioned it to a 3-digit number for ease of access.
Mm-hmm.
As part of that, Heart of Florida United Way has served as the entity that has managed the 988 suicide hotline or referral line for Orange, Osceola, and Seminole counties for the last 10 years. And so really it's a free service to the community. You can call it anytime. It's manned by a person. You're never going to get a computer. You're never going to get an automated. It's 24/7, 365. It's a resource that's available. It's fairly funded. And we continue. Last year alone, we saw in our 3-county area footprint, we saw roughly 20,000 calls that were answered by 988. And I think the other important thing that, kind of Dr. Stahlman hit on, which I think is very important, is that there's many outside factors that impact your mental health. So as part of 988, we also manage the 211 referral service line, which is a
Right.
line that people can call. Is free of charge. And they can access available resources from community partners that they can, if you need help finding food, finding shelter, we will give you that information. And many times what we see is that somebody will call 211, and then we have a conversation, and then maybe they are going through some sort of mental health need at that time, or some mental health crisis. And our operators are cross blended, so they can handle both getting you referrals to kind of the point of Dr. Stahlman, which is like assessing some of your needs, and then also be able to talk to you through sort of your mental health issues as well as at that moment in time. So I think 21988 is a very important resource in that community that's free of charge, that we're very proud to continue to promote, so that people know that there is someone that they can call at any time.
Right. I was reading, I saw when I was looking for the stats and everything, I have seen, how many people have called in to 988 since it was launched, over 150,000. Do you see the trends going up? Are you getting more people calling? And do you think that's just because you're able to get, um, it's getting, more PR, it's getting out there more, or are you just seeing the trends of people reaching out more?
I think it's a little bit of everything. I think we've been very mindful that we want to promote this so that people are available. I don't want to speculate on what, but we continue to see that there's a need, right? I mean, 20,000 in 1 year, there's people that need this service. There's people that are
Right.
going through trying to find housing, trying to find shelter, right? That sometimes they just need to have somebody that they can call and have an ear that they can listen to, or that they can call and be connected to organizations like Dr. Stallman's organization, that they can all of a sudden maybe get the healthcare that they need through organizations that we partner through. So I don't know if I would assume there's always going to be need for this, but I think we see it as that integral community connector to make sure that people know that there's somebody out there to give them a helping hand, and then that they can be connected to organizations and resources that are available. And I think that's just as important as, if not at times, right, that is the underlying issue with some of that may be causing you stress.
And Rep, I would add, just as a side note from what Daniel has imparted here, in 2022, Mayor Demings and the Orange County government embarked on something that was facilitated by the Heart of Florida United Way's team called the Behavioral Gap Analysis. And it was
Mhm.
really the first time in a long time that a group of over 50 organizations came in to really take a look at what was the continuum of care and where does gap exist for how people get access to different services. And I can tell you that overwhelmingly, the number one issue that came back about how to get access to care, because we have wonderful organizations, not just like the Mental Health Association and Heart of Florida United Way, but so many others here in our community that are available to support individuals along a continuum of services. But as the individuals were reporting back in the gap analysis, that access to care was being impeded because people didn't know where to start. Where or
Right.
who do they call first? And oftentimes it's the 211 access that United Way provides, or sometimes even it's the 988 where they're in crisis, but they're not sure how to go from there. And so I think one of the issues that we still grapple with, even from those reports from 2022, 3-4 years later, our community is still telling us that despite the robustness of information and organizations that are out there available and willing and able to provide care, many people don't know where to start first.
Yeah, I was going to say that. I know that it can be overwhelming at times, just daunting for people to look for help, and oftentimes they don't know. I can say as a state representative, a part of our job is just ensuring. And for full disclosure, my cat is here, so I'm sorry if he's muffling or making noise in my
You know
in
what?
my.
That's a great self-care
Yes,
item.
yes, exactly. I don't know if he's making any noise or anything, but that's part of what we try to do as well, is to share resources. A lot of people don't know that there are resources available to them. And so, we want to make sure, and we're always trying to highlight, both of your organizations so people know, that there are places out there where they can get help. And I was going to say, like, you kind of mentioned each other's organizations a little bit. Do you collaborate, and what are some ways that you collaborate?
Well, it's interesting that you point that out because we're just coming to the end. It's Suicide Prevention Awareness Month. And the
Hmm.
Heart of Florida United Way is an investor in the Mental Health Association of Central Florida's campaign for suicide prevention called You Are a Lifeguard. In fact, we just cross-pollinated in social media posts over the last week or so. But more importantly, we participate and collaborate in providing information on the You Are a Lifeguard campaign. That's youaralifeguard.org, which is a PSA program that promotes people to take a pledge to become a lifeguard for themselves or someone else. And so the PSA behind it is the international sign for suicide prevention is the life preserver. But if you don't have a lifeguard that's attached to the rope that can bring you in, you're just going to bob on the water. And so Heart of Florida United Way and the Mental Health Association with the You Are a Lifeguard program is promoting, and has been for several years now, this concept to take a pledge to become a lifeguard. It doesn't take a special training. It doesn't take any special knowledge to just push into somebody and say, hey, I don't think you're doing okay. I've noticed this. Or can I help you with that? And one of the things we really want to say, really specifically within the Hispanic community, is that sometimes has tremendous stigma when we talk about suicide prevention and we talk about the verbalization of someone having anxiety or depression. And I am here to tell you, and I'm sure Daniel can back me up on this, that asking somebody if they're thinking of hurting or harming themselves does not make someone want to do that further. It's actually the opposite. And that is the best way to destigmatize. That is the best way to hopefully become a lifeguard and try to save someone's life. Because just by asking those questions, that can sometimes be all that's needed to bring that person back from the brink where they can feel connected. And I'm sure Daniel has something he wants to say about that.
No, I mean, I agree 100% with what you said, Dr. Stallman. I would also add, Rep, you kind of asked, we at United Way, so I think number one, yeah, we did the health assessment for Orange County. And as part of that, I think the continuum of care and recognizing that its access is also our workforce around mental health. There's a need to be an investment. But I do like to point out, and I think this is goes to kudos to the community that we live in, that the mayor and the community organizations saw the need to invest on seeing where we needed to address mental health, not just from a very kind of narrow scope, but a very large, like, let's look at everything that needs to be so that we can have a robust mental health structure and system in place in Orange County. So I think, I just want to say that's just talk about the type of investment that our community wants to make and the type of investment that we want to see. So it's always just things like that, I think, get lost in the communication. But then on top of that, Heart of Florida United Way did embark on what we call our Be a Mind Leader campaign. And this was a partnership with Advent Health, in which really we focus on taking the stigma out of having those conversations, taking the stigma out of asking for help, taking the stigma out of your mental health issues. And we've also transcreated it. And I want to make sure that I emphasize that we're not translated it. We are transcreating the whole campaign into Spanish and Haitian Creole to make sure that people understand how to have those conversations, especially young kids, to teach them, that it's okay to seek help and to have those tough conversations as well. So I think, once again, I'm always impressed with the type of investment and sort of the thought that our community has in Orange County about these issues and how important those things continue to be. And I think Dr. Stahlman said something that was very important, is that this isn't just part of like getting mental health. This is part of a holistic everything approach to health, that mental health is healthcare, is not a separate thing. It's part of taking care of the person itself.
And I would say too, Rep, that through again that cultural lens, since we're talking about Hispanic Heritage Month, mental health services unfortunately often go underutilized in Hispanic communities due to barriers like language, cost, immigration concerns, or quite frankly, lack of cultural competent care. And so this oftentimes will delay support until crises emerge, which is very common, and we'll see things at the time where they're at their worst. And so at the Mental Health Association, we promote or try to promote something called before stage 4 as a philosophy to embrace your mental health being part of your overall health, right? So
Mhm.
when we have a young child 2 years old, we teach them to brush their teeth for good dental hygiene. That's about the same time that we should start talking strategies with our children about how to manage their mental well-being and their mental health, using their words to express their feelings, talking about when or they may or may not feel angry or sad, and helping them to create good foundational strategies, just like with brushing your teeth, so that when they get older and they're starting to be able to encounter more significant issues, they have a way to manage that. In many instances with physical disabilities or issues, breast cancer, blood pressure, diabetes, Crohn's, we can just go through a whole list, heart disease. There are amazing preventative programs in place to help individuals so it never gets to that crisis point where they have a heart attack or, God forbid, find a lump in their breast, but they're doing self-examinations. But when we talk about our mental well-being, we generally don't have very many preventative campaigns in place. In fact, we wait till the crisis. And so that's the basis for before it gets to stage 4, be that mind leader. Talk about what's going on. Invite somebody into a conversation about how you may be feeling or how they may be needing to get support. Those are all ways within every community where we can invite conversation to begin so that we don't have a conversation in crisis.
Yeah, absolutely. I think that's where the real work of destigmatizing happens, when people just grow up without the stigma at all. You don't have to do the work of destigmatizing it because, like you said, it's just a discussion like any other discussion that you have with your kids. It's all part of like, how do you feel? Just like if you have a headache or you have a boo boo, if you're also feeling emotionally overwhelmed, that's just something that you talk about in a household. And I think that's really, really
And
important.
within the Hispanic communities, it's difficult for some of our older, more mature. So I'm 61, so I hesitate saying older because that kind of just makes me annoyed. So I say more mature. But for our more mature individuals, where we were not schooled in talking about how we're feeling, the generation that my daughter is in, where she's 17, that's something that is just very much more open and an opportunity for expression to exist. So
Right.
it's almost like the generation we've got now has kind of figured out the secret code, or is at least trying to crack the code. It's the more mature folks like maybe you and I that are not as comfortable maybe talking about how we're feeling, where that space was never really provided or defined as being safe. And so we have to kind of push in for them. But I would like to say that there's hope coming, because as we've seen in this generation, they do seem a little bit more open to the opportunity to be more forthcoming about what's going on with them, and to not see the conversation about mental health being so stigmatizing that it becomes debilitating. And I guess that's also the basis behind the Mind Leader program as well, and its target specifically to that middle and high schooler, helping them to become supported in understanding how important it is to talk.
Yeah, and I want to make 2 points on that. Number one, I think Dr. Stahlman hit on something. The language barrier is always an issue. 988 and 211 do have translation services for over 27 languages. So if you were to call and you needed translation services, we have the ability to try to get someone that speaks your language to help you out. So I think that's an important resource. And I will say, speaking from personal background too, I do think that in the Hispanic community, our mature generation seems to have that issue just expressing emotion at times. And I think that is also part of just how you grow up at times in the Hispanic community, having an issue kind of knowing how to communicate how you feel at those moments in time. So I think that it is something that, to Dr. Stallman's point, it is really what the Mind Leader is there. Is just how do we start having those conversations earlier so that people feel that they have the tools in their toolbox to approach these conversations when they need help in a preventative matter. I always think about, you look at Florida, we're hurricane prone, right? But mental health in my mind is sort of like a hurricane at times, is you need to prep and not always wait until the hurricane hits to take care of things. If you're ready and do the things that you can ahead of time, you may be able much better to handle when the hurricane actually hits. And so I think that's a good way to kind of look at mind leaders. Let's have those toolbox. Let's be prepped for the hurricane and not just wait for it to come to us.
Yeah,
Right.
definitely.
And I can say there's also hope in the sense that when I was going over the 2023 report from DCF, Orange County and Osceola County are among the lowest counties now when it comes to suicide. And I think a lot of that is because of the investments that they were, that the counties have been able to make in the resources that they have for people. I mean, it's obviously still there, and it's obviously something we have to keep working at until the number is zero. But when you look at the map and you look at the heat map, the rural areas are really are the ones that are struggling right now, and they're also the areas that don't have the same resources that we do. And so that kind of brings me to the next portion of the discussion before we open it up to questions, and that is, we rely, the state relies so much on federal funding, and there is so much talk about the federal funding. I have concerns, and so I wanted to hear from you. Are you looking to what funding may be cut and how that's going to impact the work that you're doing?
Yeah, so gosh, it's just, there's so much there. So let me just say one more point to yours about the heat map with Orange and Osceola. While those numbers have shown a decrease, Orange, Osceola, and Seminole counties are three of the counties in the state of Florida right now showing the highest rates of uninsured against the national average. Orange County is at about almost 14%, and the national average is about
Right.
9.3. That's going to go up. And the reason for that is in January, subsidies and tax credits for individuals that are currently getting insurance through the Affordable Health Care program are going to see significant cuts, or they're going to go away entirely. And so all the work over the last 12 years to work on lowering the uninsured rate here in the state of Florida is going to be repelled or repealed by what's coming in January. And so that's a tsunami that we are not anticipatingly prepared for as we look ahead in the next couple of months. The other thing that will influence that is Medicaid has not been expanded here in Florida, as we know, and the redetermination and termination of Medicaid benefits also has now contributed. So within our Tri-County area of Orange, Osceola, and Seminole counties, when we talk about suicide rates being down, we're not seeing the number of uninsured going down, which means that their access to affordable healthcare options, both physically and behaviorally, have and will be less. And that's where the risk intersects with where those numbers might start to go back up. Back to your question here about within specific communities. We know that suicide rates among African American males between the ages of 11 and 17 are higher than any of their other peers, second to Hispanic, and then AAPI third as males. The reason for that is not that those groups are more likely to be depressed or facing anxiety issues that can draw or drive them to suicide ideation. It's that at the point of the suicide ideations, they have access to firearms. And so the completion rate with a firearm is almost 90% of the time successful, where in any other means attempted, it's less than 6%.
Yeah, I know. It's one of the points that we try to make when we discuss, you know, gun violence. Is that I know that a lot of times mass events are what kind of catches the eye of media. However, there are so many deaths that are attributed to, unfortunately, suicide, and that's something that needs to be discussed as well, when we think about laws around gun safety and what we can do.
And I
Getting
really think that that goes to your second question, which is what is the role that policy and local partnerships play? Because as we move Florida now into an open carry state, we're not debating whether or not someone has the right to a firearm. We're debating whether or not that firearm should be kept in some place safe. And in particularly around individual children and adolescents who might be more predisposed to having suicide ideations or anxiety or depression that leaves that firearm as a ready, accessible mode to kill themselves.
Yeah, and I think I would add to your question on the policy side. I think, we as United Ways, we will continue to advocate for ALICE. And for those that don't know who ALICE is, those are asset limited income constrained employed. Those are people that are paycheck to paycheck. And we go back to that conversation of what is a trigger for mental health issues is your ability to put food on the table. Are you choosing between fixing your car and getting to work or being able to feed your children on a daily basis? So I think as a whole, we look at a lot of policies that have impacted. I think we continue to advocate for housing, but I will flag this, as we see some of it, I think the nonprofit sector has an uncertainty on some of the federal funding. And, that continues to become a thing of some of the funding may or may not be there. So that may put constraints and compresses the ability to a lot of the nonprofit sector to provide services as a whole. Or it means that we have to go and, go look for funding elsewhere. So I think that's big picture what we're thinking and we're looking. And I will tell you with 988, this is one of those interesting situations with 988 is 988 when the original transition happened, the first Trump administration was in place and they put funding behind it. And some of that funding does have a sunset period. And so we're wondering what's going to happen when that sunset period comes through and how that's going to look. So I think from that side, that's what we're looking. But once again, I am hopeful. I feel like we live the counties that United Way represents. We have people like Dr. Stahlman, the Orange County government, Osceola County government, Seminole County that are willing to engage in conversations, which I think makes it easier for us as a community to be able to be prepared to react to some of these policy changes. But I think, and the final thing on the policy side is, and I apologize for that, my dogs are barking.
They have a lot to say too.
They have a lot to say on this issue too, as you guys can hear.
They
But
do.
I think the bottom line is housing continues to be one of the biggest issues that our community is going to struggle for a time, and until we get some of that, that's also going to put strains on people's well-being, the ability to afford housing. So I think mental health is a big issue that we need to tackle, certainly, but there's so many outside factors, as Dr. Stahlman said at the beginning of this, that have so much input and affect people's well-being that is important that, the policy is not just mental health itself, it's everything else that could impact that as well.
The analogy that I like to use is if you can imagine over an infant's crib, a mobile where it's got a giraffe and an elephant and a tiger and a lion and a hippopotamus, and it's very still. And then a fan or a breeze comes and it hits the elephant, which is on the right side. The whole mobile moves.
Mm-hmm.
And that's how we need to look at not just our community from a policy standpoint, but also as an individual. That there are so many determinants that are breezing and influencing what and how we are reacting on any given day, that it's impossible for our mental health not to be affected. And that's why it's so important to talk openly about the fact that our physicality and our behavioral and our psychological well-being are inextricably linked. They can no longer be set aside and put in silos, and we have to look at a whole person.
Right. And I think much like that, how we have to look at, our mental health as part of our overall health, to Daniel's point, we have to look at mental health as it kind of connects to affordability, being unhoused, and, access to healthcare in general. Like, all of those have such impacts on our mental health. When you don't know how you're going to make it from month to month, that cannot not impact how you're feeling overall, how your mental health is doing. And if you're already somebody who does have, a mental illness like anxiety or depression, that just further exacerbates it. I just want to say I've really enjoyed this discussion, and I do want to give it, I do want to give this opportunity to open up the floor a little bit if anybody has any questions, for either myself, Daniel Vanegas, or Dr. Stahlman. We're here to answer any questions that you may have.
I will say before that, easiest thing that they could do is try to figure out traffic time on I-4. I think that would alleviate a lot of people's just day-to-day well-being.
No, traffic is it is an issue where it has been shown to raise blood pressure. And it's not just I-4, it's all over the county. I mean, that's one thing where I think countywide we can all agree. Traffic is horrible, and we need more access to public transit. That is something I think everyone I talk to agrees. So does anybody have any questions out there I don't see any questions. And that's okay if you don't have any questions. That is fine. I see that some resources were shared, and I appreciate that, Dr. Stahlman and Daniel. Before we wrap it up, I wanted to ask each of you, and I know this might seem, um, given the current climate, I know this might seem a fruitless task, but I'm going to ask anyway. For each of you, if you had a minute with the entire Florida House and Senate, what would you say to us all together? I'll start with you, Dr. Stahlman.
I would say, and this is going to seem very down in the weeds, and maybe not a lot of people will understand or reference this, but I know you rep well, that we need to expand the Tristan Murphy Act, that we need to decriminalize individuals that are going into our local county jail systems that have mental illnesses, and we need to put more resources behind making sure that individuals are not utilizing our jails as the best option they have for mental health treatment. And that's a big wrapped up, gift to talk about. But for those that don't know, we have here in Orange County, the jail is the largest provider of mental health services in our region. And that is because oftentimes individuals with mental health illnesses or in mental health crises are being criminalized either for standing on a street corner or sitting down on a bench or anything in between. And we need to look at people as human beings. We need to invest in community-based resources. The Commission on Mental Health and Substance Abuse that was convened after the Marjory Stoneman Douglas event has a wealth of recommendations that have come down over the number of years that have gone by the wayside and only been partially implemented. And if we truly want to make an impact and make Florida the best place in the United States to live, then we need to make sure that we're taking care of the people that live here.
Yeah, I think for me, I would say two things. Number one, I would say don't, the plight of Alice continues to be, Alice is everywhere. Alice is unseen at times. There's many people that are working very hard and are working paycheck to paycheck, and you would never know, but they are paycheck to paycheck. They are one crisis away from disaster. So I would always say, like, keep in mind with the policies that would make that the plight of Alice is at times very much unseen, and people are not always aware of who's going through that. And that, from a mental health and just a health well-being, is that plight has an impact on people, and that investing on those folks is investing on the long-term benefit of Florida as a state as well. And then I would say, and to quote United Ways, is our superpower is our brand. And I would say that sometimes community trust into organizations like Dr. Stahlman's United Ways, Second Harvest, all those other ones that are doing good work. I would say continue to invest in those folks, because those are sometimes the boots on the ground that really help our communities. And in many cases, some of our organizations serve as the canary in the coal mine that picks up issues that are maybe unseen at times, right? And so I think I would say continue to invest in those well-trusted community organizations that are doing good work.
Thank you so much. I really, again, I appreciate both of you for being here and for spending some time with us to talk about this. It's a really important issue to talk about, and I wanted to, I really wanted to highlight it and talk about it because, full disclosure, I have OCD. I have a mental illness myself, and there have been times in my life where I have had ideation, and it is something that you have to talk about. And during those times, I was also Alice. My husband and I were Alice. And so that's why I'm saying there is such a huge correlation between, but I want also people to understand it's not just socioeconomic. There are people that could have everything in the world, but if you're dealing with something and you're afraid to talk about it, you don't feel like you can talk about it, you're still going to be impacted. So I want everyone to understand that no matter where you are, it is always something that you can talk about. And there are organizations here that are wanting to help. They're here to help. They're here for you. And so we want to ensure that you know how to reach them and get a hold of them. And so that's why I'm so grateful for you all being here this evening, and want to make sure everybody knows how to reach out to me as well if they need anything. Rita.Harris. I see James is flying through those. Thank you. Rita.Harris@flhouse.gov if you need anything, if you need any constituent services. And of course, if you need to reach out to any of the organizations on this evening or any other organizations, that's what we're here for. Thank you again for joining us this evening. Thank you, Marni, for putting your number down there, Dr. Stahlman. And thank you again, Daniel, for being here. I hope everyone has a great night.
Thank you.
Thank you.